You're listening to the Public Health Entrepreneurs Podcast with your host, Dr. Charlotte Huntley. Greetings, everyone, and thank you for joining me on this episode. I have a guest joining me, and I'm really excited for you to hear our conversation. I am thrilled to reconnect with Neshé Conley. She's founder and CEO of Ebony Women Health Corporation. And this is a powerful conversation about building businesses that honor lived experience. Neshé and I first connected years ago when she was navigating the early stages of her entrepreneurial journey, and watching just her evolution has been remarkable. In this episode, she shares how her own traumatic birthing experiences led her to create Echo Her, which is an app that collects narrative data from women and birthing individuals of color. We explore the discomfort of sharing personal stories, the power of community connection in business growth, and how one virtual event led to a transformative partnership. This conversation offers valuable insights on product development, relationship building, and staying true to your calling in public health, especially entrepreneurship. Let me connect our conversation right now. Hi, Neshé. How are you doing?
I'm good. How are you?
I'm good. I'm excited for the chance to get caught up. I know we were chatting for a while before I hit record, and I said, it's time. We're just going to hit record and jump in.
Yes.
So why don't you just take a moment to introduce yourself? Tell us a little bit about what you do and who you are, where you at.
Yes. So my name is Neshé Conley. I am the founder and CEO of Ebony Women Health Corp, as well as I have a nonprofit foundation called Conley Cares Foundation. And the work that I do and under Ebony Woman is that I focus on narrative data collection and my fight to prove that lived experiences can be evidence-based data in the field of public health. So through an app that I have called Echo Her, we collect stories from women and birthing individuals of color. And in that space, they are able to ask unanswered questions, have some uncertainties about certain things that was told to them or they felt like wasn't addressed. They can bring that all into that space. So what I do not only support the mental and the physical, the holistic approach of what it looks like to be a Black mother or birthing individual, but I also, using AI, pulled out gaps and trends from the conversation, from the questionnaires that we create to be able to further research. We went to a lot of conferences. We do a lot of community programs and events to pour back into our community. So that's where I'm at right now in the work that I'm doing under Ebony Woman.
That is amazing. You and I met a few years back, and you were doing something different.
Yeah.
And we've been in touch, and it kind of, followed each other. And I feel like lost touch a little bit. You know how the world kind of separates us out and we do different things. Mm-hmm. And you're back on my radar just recently. So I'm really excited to be in touch with you. And I'd love to know let's talk a little bit about the journey. Because for people who are listening and maybe didn't, you were on my other podcast. I interviewed you a few years back. So people may or may not even remember that. But let's just roll back a little bit and talk about kind of how you got here.
Yeah.
Tell us, just kind of start where you'd like and just kind of share that bit of the journey.
Yeah, of course. So this life was a journey. I think the last time we spoke, I might have just had my third child. And as we kind of mentioned, now I have 4. So I have a 2-year-old president of this household. But yeah, so I think when the last time I was on here, I was probably about a year maybe out of graduate school. So I was really in a space of knowing that I wanted to get into public health, get into entrepreneurship, but I didn't have the clarity of what I wanted to do. I feel like a lot of us sometimes in public health, because it's so broad, we're just I don't know where to go, where to be, where can I really thrive and support the community that is within my expertise. And that's what it was for me the last time we met. So I knew I wanted to do something for our community, African American community, because of my own upbringing. And during that time, it was more of programming, creating programs for like the community based on like different topics. So again, I just want to do everything in public health.
Right.
But one thing that really changed in this journey from then and now is me being true to myself and true to my calling. Through that journey, I really was fighting. Because, like, my husband will tell you, I am stubborn. I can be stubborn sometimes. I wasn't listening or accepting the calling that God created for me because it made me uncomfortable. I was just like, I went through birthing experiences from me losing a baby, because I actually had 5 pregnancies. Me and my husband lost our first child. So going from losing a baby to being hospitalized because I was dismissed to having a racist comment towards my child from a medical professional. I didn't wanna tell my story because I was scared about how people was gonna perceive it, judge me. A lot of people know me from Philly, like, "Oh, she tough. She from the hood of Philly, like, you ain't gonna let nobody talk to you and da 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 da." I didn't wanna deal with that. I didn't. I was just like, "Listen, Imma keep my little stuff to myself and show up ways that I felt comfortable to do." But that's not why we do the work in public health. And I had to really connect with my spiritual side and my professional side and understanding that God did not give me my story just for me to put it in my back pocket. God gave me my story to lend and share with the world. And whoever it's for, they will receive it, they will accept it, and it will help them. And if it doesn't do that for you, that's okay. But it was a journey of not just doing community work. It was a journey about me developing who I was as well. And I can sit here today and saying that because of how the world changed in regards to like the political side of things to just the public health side of things, I had to learn to use my fierceness. I guess my Philly side, I had to learn how to use that and just stand tall in what happened to me and stand tall because what happened to me is not unique to what happened to other women of color, mothers and birthing individuals of color. And I can't hold my story and expect things to change when I know how to connect the two from the professional and personal side of things.
It's wonderful. It's really powerful too. Tell me about your business. Tell me the name of your business again and what prompted you to start this? Because I know I'm familiar with your entrepreneurial journey. And just like with any entrepreneurial journey, it's not linear. Like
It's
we're
not.
all, we're discovering, evolving. This is working, that's not working.
Yes.
But, what are you doing? What's the name of this business? And what was that turning point? What was that pivotal moment that said, this is it? Because I feel like we've landed here and this is like what you were working toward all along. So share with me a little bit more about that.
Yeah, so my company name is called Ebony Women Health Corp. And Ebony means Black. Ebony is actually my middle name. So again, that's that personal connection to it. But what we do, we're a premium care and equity firm. So I have a team of public health students, experts that has from probably 1 year and still studying to 20 years of public health expertise. But what we do with Ebony Woman, we use narrative data. So that is basically storytelling, like this experiences of our community members. So we take their stories and we really utilize the holistic picture, their wording, what it feels like for them and their experience. And we use AI to pull out just gaps and themes that are getting overlooked, really, and what is happening. And what really clicked for me is that when I was going through my maternal health journey, I didn't know where to go, really, right? Like, and a lot of us that are mothers is not in the public health space. So when you're trying to figure out the language of you're telling me preeclampsia, for example, what is that? I don't know what that is. There's little dots. What's the little dots? There's floaters. Like sometimes the language is hard for us to really connect and to be able to really thrive and be safe within our pregnancy. So with Ebony Woman, we acknowledge that. So with the team, we are able to say, hey, this is what that is. Or this is a question that you have, this is an expert that you can connect with and support you. So we use that and then say, aha, because this is a trend of what's coming up in regards to like medical neglect or medical racism is one that's popping up for me, is like a topic that always comes in our community. Let's learn more about that. Another topic that comes up a lot is mothers, and we got to dig a little bit more deeper into that, but mothers over the age of 40, they're starting to increase. Honestly, there's a lot more women that are starting to have babies after the age of 40. And there's not a lot of information that is ingestible for us to understand what that looks like from outside of the public health realm. So we're able to create this space of this community, use our expertise in AI, because AI is an
Yeah.
amazing tool to use, but we do still have eyes of human
Right.
professionals to look at what is coming up. But we use those things and those gaps to say, hey, let's partner with this organization because they might be doing the work, but they may not be doing the work that is effective for women of color or birthing individual color. Then we create resources and events that we pour back into the community, funding opportunities for certain organizations. If, somebody wants to do a certain project, hey, this is what we're finding in our data that you can use if it's, tailored to the target audience, which is women of color, birthing individuals, and people of color. So that's basically what we do. And that's something that I knew that I miss in my journey. So being able to create a business that say, hey, you take this thought and idea that I have or this question that I have, and you can do all the public health things in it and make it make sense to me to where I'm safe in this pregnancy. That's kind of how you can look at Ebony Woman.
Nice, nice. You did a great job of explaining that, and I'm excited that this exists. I know just thinking back in, my friends and my generation and my journey, I have 3 children and that I birthed and just the challenges because my last one was high risk and just everything, that I dealt with and how, just how I processed that and handled that. There was no support. It was just. But I'm curious what prompted you
Hmm.
to start this business?
Hmm. Honestly, because of my daughters, because of my younger sisters. I felt uncomfortable having my own experience and knowing that now that I have 2 daughters, so my older 2 are boys, my older 2 are girls. When I had my oldest daughter, she looks like me. Like my other kids, all my husband. I'm sorry, I'm done. I got 1, right? I just got 1. But I saw myself in her and I refuse as a mother to allow, like all of us, any parent out here, we don't want our kids to go through what we went through that was like traumatic, of course, right? So, how can I be such a well educated Black woman, know and be aware of what is happening and not educate me on how can I not only protect myself, but be able to do something that will later protect my daughters, my younger sisters, even my sons and their partners, if they decide they want to have kids and all that, and like my little brother. So that's what really prompted it for me. It was an uncomfortable feeling for me. And I knew because I felt uncomfortable, it was something that I had to do.
Yeah, yeah, yeah. I can relate to that too. I'm glad that you did, that you're here and that you're doing this work. How long has it been now?
Oh, I've been doing this work for, I'm going to say about 4 years
Okay.
now. Yeah, I've been
When
doing
did you
the
start
work.
the Ebony? The
That's 2 years.
2 year okay, okay.
Yeah, that's 2 years. I always been doing the work, but I had
Yeah,
that imposter syndrome where I'm just like, "I don't need to start my own business for this. I don't got time. Let me just support and help other organizations that's doing the work, that have everything established. Let me just pour in a little bit,
right?
consult, and then step back." But I realized it wasn't fulfilling me. It still wasn't enough. So that's
Mhm.
2 years after that, I decided just to go ahead and start the business.
That's wonderful. I'm excited for you, and you also have, let you tell the exciting part, but I teach so much when I coach my clients who are entrepreneurs on this journey of building business. I lean into being passion driven because that's really being connected to the work on that level is
Yeah.
what gets you up every day, moving every day, doing the work regardless of what's going on. And what you just that's why I was asking so many questions, like, what was it when you
Mhm.
decide that it's, and for you, the way I would interpret that is I have to get out of my own way. When it's
Yeah.
bigger than me,
Oh,
it's
yeah.
about who I'm helping someone else and their impact. It's not about me, then I don't get to just decide because I'm feeling nervous not to do it, because then
Mhm.
I'm interfering with what is meant for someone else. And
Mhm.
that's, what you've just described, really tapping into that passion, that vision, because all of us in public health as entrepreneurs, we're really connected to the impact we want to have with
Yeah.
other people, right? So you've got that real clarity there. And, another thing is I talk a lot about cross-sector partnerships and collaboration and that power that
Mhm.
exists when public health crosses so many different fields, but when we really connect with those overlaps, there's a lot of power there. And
Mhm.
you are this what I'm leading up to is you have a very wonderful example of that, which I'm so
Yes.
excited about for you. So please share about your partnership and collaboration, if you would.
Yes, yes. So, funny story about kinda like to go off what you were saying. I was hosting and we're gonna get back to doing these unanswered question virtual events. They were free virtual events because, of course, the pandemic, everybody was online. So they started off virtually, but people in my community were able to send me questions that they felt that was unanswered, and I will go out and find experts to address and talk about this topic for them. So we had one that it was focused on traumatic birthing experiences. So I had like 7 speakers on there. Like it was just a powerful, powerful event. One of the participants actually worked for United Healthcare and attended my event. And I got a phone call. And it was funny because I remember this day I was stressing entrepreneurship. When are you not stressing, right?
Right.
I was sitting at my kitchen island and my husband at the time was like in the living room or something. And I'm sitting there doing some type of work. I don't know what I was doing. Got a call. I don't answer unknown calls.
Right.
Sometimes I'm like, I don't know. But I answered it. And she introduced herself. She told me that one of her colleagues attended my event, connected with the work that I was doing, and they told me that they invest in businesses and nonprofits that do impactful work for the community. So she told me to apply for it, and I did. And probably about a month later, I found out that I was selected to receive this $326,000 investment from them. And when I say still, when I got that call, I hung up and I was like I told my husband, I said, "Guess what just happened to me?" Like, I was so confused because 'cause I'm, like, sitting here stressing, like, I don't know how I'm about to pay this, pay that because, that's how we live sometimes as entrepreneurs, especially when we're
Yeah.
in a not a product, more of a service-based
Mhm.
company or business. But this investment for United Healthcare, when I spoke with them, me and a lady literally cried based on our experiences. We wound up having, like, a virtual meeting, and she was just like, "I can't cry, Neshé," but she had the same experience. She had a birthing experience, and that was really she was a Black woman, of course, had a birthing experience, and that was so traumatic for her, and she was just like she connected and wanted to make sure that she did her part, right? And being able to invest in someone or a company that was doing the work that's needed for us. So, when I say we was in there crying, I was like, "I know," and I'm just like, "We just gotta do something. We can't stop fighting." It was just validation that, like, partnership is big,
Yeah.
but I always hear this saying that people invest they don't invest in a product a lot of times. They
Mm.
invest in people. So,
Exactly.
when me and her had that connection, I just knew it there. It solidified that partnership and that investment into Ebony Woman and Echo Her, the app that they're supporting. And it's not just supporting the app, they're supporting us being able to go in the community and creating programs and resources and events to support those. So the work that we're doing, I don't want it to be seem like, oh, we're just creating a product and putting it out there. No, we are focused on sustainability and how can we not just take our product to be impactful for the community by doing those programs, helping them. We have a partnership now that's in the works that will allow us to give donated baskets, baby baskets to moms. And, there's other partnerships with mental health therapists that had the same story and was like, we got to do something. So now, our moms in our community, we can support them, help them with getting that mental health support if needed. partnerships is so crucial, and where that funding, oh my goodness, what I mean, like, is going to change everything for us. It's not just changing the business, but for my personal story and to be able to build that awareness of like, hey, I was there. I could have lost my life multiple times,
Mhm.
but because someone saw me and saw the issue in a different lens, that's why I'm here today to be able to share this with everyone. So I am grateful. I am blessed to be able to get this investment from them. And I'm excited to see where it's going to take our company and nonprofit to the next level.
Amazing, amazing. So you have your corporation, then you have your nonprofit also.
Mhm. Mhm.
And thank you for sharing that story. I think it's encouraging, and it just iterates. I like what you said about people do business with people. That is
Yeah.
so true.
Yeah.
I teach so much about relationship marketing and
Mhm.
getting to know people and not just being transactional. I mean, I love all the tools that we have. I'm a big proponent of being on LinkedIn and using those, social media platforms, but not just being transactional with a post and just, or clicks, but really developing relationships. Use that as a way to connect with people that you feel some synergy with and having conversations, meet with somebody and don't just keep it surface, but really being willing to, I talked a little earlier about, I think before we started recording, we talked about vulnerability. You have to be willing to be a little vulnerable and open up, and you don't have to expose everything, but
Yeah.
you have to be willing to share and connect with people on a very human level, a relatable level.
Yeah. And to add to that, and that's why I developed Echo Her, because it wasn't like, oh, apps are like the big thing now, so I just want an app. It
Okay.
wasn't about what the product looked like. It was about what is the purpose and how can people connect with me and how people have connect with me in the past that led me to this space now of developing this app. So, and then you think about vulnerability when you're creating something, regardless if it's a product, it's a service, whatever it is, when you're creating something, you have to be vulnerable with that community to
Yeah.
understand,
Yeah, that's right.
because your product ain't gonna be nothing if you don't understand exactly where they're at and meeting your target audience where they are. Like
Right.
I don't have any kids. My oldest child is 7. So if y'all are a parent of a teenager, don't come to me. I don't know. I don't know. I'm not there. I may ask you a couple questions to get to that point, okay? But that's why I created this space, because if I can't answer that question, then I'm going to find somebody else that can. And I didn't have that. So that was a disconnect with a lot of this stuff. When you develop apps, other apps is serving a purpose that is a missed opportunity or a gap or a need that
Mhm.
somebody's wanting. When you're creating clothes, like I want a good cozy sweater. And when Uggs came out, I was like, yes, the fur, that's what I need in my life. It makes me feel safe and warm and all the things, right? Like when you're in product development, and this is something that I learned in entrepreneurship, when you're in product development, it's not about just, hey, I can make X amount of money off of this. It's saying, hey, this is how I can serve a community need. And
Yeah,
that money can be, threefold,
that's
which you
right.
thought you was going to get just because you focus on the product. So that product analysis and understanding on the actual needs of the community, being vulnerable with your community. Like I had conversations with like 50 people about, hey, I asked them, do you feel like a digital space would be good for this issue that we're having in Black maternal health? Some people said yes. Some people said maybe. Some people was like, I don't even know what a digital space is. So like, but it helped me. It literally helped me to get a clearer understanding. Okay, like language that I should use, what I should implement into this product. And
Mhm.
then also on the other side of it with research and public health, what is already out there and what is already happening. Like we have a lot of focus groups, that's a thing, but these focus groups sometimes can feel real sterile. It can feel like, hey, if I answer this question, are you going to take my babies? I
Yeah.
had an experience where somebody told me that those questionnaires that we had to fill out postpartum, sometimes they don't answer it honestly because they're scared that something is going to happen to them. So that's a missed opportunity right there, not just for public health, but for the healthcare space, because we are not being able to really truly grasp what is happening or being able to truly touch someone because of the systems or the ways that we already have. So why not be innovative and create something that's different, something that understands the language of what a woman of color need to be able to thrive. So that's kind of how like the whole journey, the whole product and the knowledge I received in this.
So I'm loving our conversation. I want to be mindful of time. I'll make sure that in the show notes that people are able to connect with you. But
Mhm.
as we kind of round out, it's one quick question about AI. Is there a specific, and I know this could change because it's ever evolving, but right now, is there any particular tool that you're fond of for doing any of your analysis work?
Really, we use AI to help pull out the themes, but we use our own team.
Yeah, yeah.
We use our own team. Our data analyst that's on the team, they have the experience on all different platforms that we use in public health, but I'm not doing the same thing that public health is doing. So the
Mhm.
approach that I have is like, hey, we're reading these stories, we're hosting these virtual interviews to not only connect, but look at it as like I can keep the emotion into it.
Right, right.
When we take that emotion out of our data is a missed opportunity. So we host virtual interviews with our storytelling interviewers. We do questionnaires that allow them to use their own language in their space. And we just kind of look at it and then AI just kind of pull out. We look at from our expertise and our knowledge, okay, this is a missed opportunity. Let's put that in here. Okay, that's not exactly what she meant. Let's reword this. You can't do that sometimes with other tools and platforms. You do that with the human heart.
Yeah, yeah. Well, thank you so much for the updates. It's been great to catch up with you and to learn more about what you're doing. And I'm so excited for you. As we're wrapping up, and like I said, we'll have all the links in our show notes for listeners. But what's the best place for people to find you and connect with you?
Everywhere. I except TikTok. I'm not on TikTok, but I just scroll a little bit on TikTok when I need that mental release. But mainly I am on LinkedIn. My name is Neshé Conley. I'm also on Instagram, which is underscore Neshé, the health expert. I'm on Facebook, Neshé Conley. We have a website, ebonywomanhc.com, that you can reach out to me there too as well. So yeah, we're on basically almost all the platforms.
Great, great. Well, I look forward to keeping in touch and following your growth and your journey. And we'll have to have you come back in the future and give us some updates.
Yes, thank you. Thank you for having me.
Oh, my pleasure. Thank you for listening. Visit publichealthentrepreneurs.com to learn more.